Hey folks, Dr. Joe Esposito here. We're going to talk now about autoimmune diseases. Now, you're thinking to yourself, but Dr. Joe, I don't have an autoimmune disease, so why should I even listen to this show? Because you might have one and not know it. And that's the thing is, how do you know you have an autoimmune disease unless you're diagnosed with it? If you're never been diagnosed with it, how do you know? When I was studying orthopedics, my professor, Rick Ackerman, brilliant man, it was a 5-year postgraduate program after I got my chiropractic license, my degree and my license. And he said, you can't diagnose it if you don't know it exists. And I remember those little pearls of wisdom he used to throw out at us. And I remember, like, he'd bring up an x-ray. He'd say, what is this? And we'd look at it. And if you ever look at x-rays, it's just a bunch of shadows. Well, it could be a gas pocket, it could be cancer, and it could be a shadow. I don't know. He says, well, if you know what this looks like, you know that this is multiple myeloma or whatever it is. So knowing that it exists is going to be the key. And then you're better able to diagnose your patient. So I want to throw some stuff out there that you might have and not even realize, and then maybe we do need to do some further evaluations with you to find out what's going on. So the immune system fights off harmful germs, bacteria, viruses that shouldn't be in the body. Sometimes that system goes wrong, and it starts attacking healthy tissues that think it's a threat. So your body says your thyroid is a threat, I'm going to attack it. Well, your thyroid's not a threat, but the immune system is not sophisticated enough to realize thyroid is safe. Don't attack it, or the liver, the spleen, whatever it is. That can lead to inflammation, damaged joints, damaged nerves, damaged muscles, skin, and other parts of the body. So you may have some issues you're not even aware of. So why do they happen? Researchers think two things happen when your autoimmune malfunctions, when your immune system malfunctions. First, you get genes from your parents that make you more likely to have one. So you can inherit thyroid issues. If your mother and your grandmother had thyroid issues, and now you want to be cautious to check to make sure you don't have thyroid issues as well. And something that in your environment can then trigger it, like a virus. So you have the genes and then something can kick it off. That's what research are kind of thinking at this point. This is the modern day analysis of what we think autoimmune diseases are. Because more women are affected than men, it could be a hormone issue. So once again, we're not quite sure why it happens, but we do know there are certain things that will trigger them. And it's the same things that I've been teaching you for the past 40 years. So I keep going back. It's kind of neat when I put this whole program together years and years ago of normally functioning nervous system, normally functioning digestive system, and good nutrition. And when I put that all together, it just keeps coming back at me time and time and time again. Oh my gosh, autoimmune diseases, digestive issues, brain malfunctions, sexual dysfunction. It all keeps coming back to the same things. And we talk about the 7 deadly sins, the 7 foods you want to avoid. And when it comes to autoimmunity, these 7 foods really stand out. And if you don't know what the seven deadly sins are, it's alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Now, many of you who are new to the show just said, wait, what were those again, Dr. Joe? Alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener? That's my whole diet. That's all I ever eat is alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. How do you expect me to live if I can't eat those 7 foods? And I'll say, it's okay. I estimate there's about 120,000 other foods that you can eat. So you don't have to worry, you're not going to starve. I promise you that. But that's not today's topic. Today's topic is autoimmunity. One of the autoimmune diseases that's really popular, and I see it almost every day in our practices, is rheumatoid arthritis. Now, this autoimmune affects your joints and causes swelling and pain. And over time, the inflammation can cause damage to the cartilage and the bones, and then you can't move very well. Rheumatoid arthritis can also cause problems with the heart and the lungs. Now, there are medications that doctors can give you for rheumatoid arthritis because, again, it's an autoimmune disease. So one of the medications that's really popular for autoimmune patients is steroids. We can give you steroids, and steroids suppress the immune system. And when the immune system gets suppressed, the immune system stops attacking itself. Makes sense. But there's a problem. You need an immune system to fight off viruses, germs, and bacteria. So when you're on steroids, your immune system is suppressed. May not be the best thing for you. So if you have rheumatoid arthritis, what we do in our office, and I never tell you to stop taking your meds, by the way. Don't ever say, well, Dr. Joe said I shouldn't take my medication. Never said that in my entire career. I want to get you well enough so that hopefully you don't need the medication. Different approach, isn't it? Instead of stopping the medication, let's get you healthy enough so the medication goes to the wayside. So a couple of things. We want to do a whole body approach. We want to keep the immune system as normalized as possible. Not stimulated, not suppressed, but normalized. If you have rheumatoid arthritis, it causes swelling, which pushes the bones out of place. Bones are out of place. They start to rub up against each other, and that causes osteoarthritis. So now you go from rheumatoid arthritis to osteoarthritis. Not good. So if you have rheumatoid arthritis, chiropractic care. Let's get those bones back in place to slow down that degeneration. Then let's calm down the immune system. And the simple thing, and this is going to be a theme throughout this whole show, the two foods that have the biggest impact on your immune system are wheat and dairy. If you can cut out wheat and dairy from your diet, you will be amazed how much better you feel. Now, let's assume I just lied to you. Let's assume that wheat and dairy are going to have no impact whatsoever on how you feel and how your body functions. Here's my challenge to you. Give up all wheat and all dairy. Not a bite, not a sip, not a nibble, nothing. No wheat, no dairy, 2 weeks. That's all I want is 2 weeks. At the end of 2 weeks, start eating wheat and dairy again. Have some pizza, have some cheese, have some bread and butter. See how you feel. If I'm wrong, I'm wrong. I lied to you. But if I'm right, which I am, then you'll say, oh my gosh, that's all it took, Dr. Joe, to calm down my immune system was cutting out wheat and dairy? In many cases, that's either everything you need to do or at least a step in doing it. And it's free. And if it doesn't work, it didn't work. So what? But watch what happens. I was at the radio station. One of my coworkers has this rash on his leg. And it's so funny. We always joke about, Dr. Joe, can you look at this rash for me? And he actually had a rash, and he showed it to me. And he says he's going to his medical doctor today. Take a look at it. And he says he put some eczema cream on it, and it seemed to help a little bit. And I said, why don't you just give up wheat and dairy for 2 weeks and see what happens? And he said what most of you say. I can't give up cheese. You want me to not have bread? I don't understand. I can't comprehend. My brain can't process the fact that you're telling me to not eat wheat and dairy products. I said, give it a shot and see what happens. If I'm wrong, I'm wrong. The same line I use all the time. So we'll see what happens if he does it or not. But wheat and dairy, everybody should try it and see how they feel. Even if you don't have an autoimmune disease, I think you'll be pretty happy with it. There's another condition, it's kind of rare, called ankylosing spondylitis. And I had a case come in this week, so that's what made me think about it. Ankylosing spondylitis is the joints start to fuse together. We don't know why. It's an autoimmune disease. But it starts usually with the sacroiliac joint and works its way up. Now, the danger of ankylosing spondylitis is if it gets into your mid-back, it can affect the ribs. And you need your ribs to move back and forth. That's how you breathe. So if the ribs are locked up, you can actually suffocate to death. And in my career, I had one lady come to me later stage ankylosing spondylitis, and she said, I don't know what to do. And she said, I can barely breathe, and the doctors say there's no hope. She was so far gone that chiropractic care helped her, probably kept her alive a lot longer than it had not, but unfortunately, she passed away. But with an autoimmune disease like that, once again, calm down the immune system. And for ankylosing spondylitis, same thing with rheumatoid arthritis, mobilize those joints. Adjust those joints and keep those bones moving. Because with ankylosing spondylitis, if you keep the joints moving, they have a tough time fusing up. It's kind of like water freezing. If you don't keep stirring it, it doesn't freeze. So you got to keep those joints moving so they don't lock up. So with ankylosing spondylitis, you can do a blood test for it. Mobilization is the key. And I have a couple of active patients with it right now. And for years, they've been coming in for regular chiropractic care, and they have not progressed. I mean, it hasn't gotten worse, I should say. The disease hasn't progressed. They progressed, but the disease hasn't progressed. So it's really exciting that there are things that you can do for something like that. And why that's not taught in every orthopedic school in the world, I don't know. I'm not sure. But that's why we have these shows, to get the word out to people that haven't heard the messages before. Type 1 diabetes is an autoimmune disease. The body attacks the pancreas. And in type 1 diabetes, you just don't produce insulin. In type 2 diabetes, you produce insulin, your cells don't utilize it. So with type 1 diabetes, it's called juvenile onset diabetes many times, but it can happen in adults too. Usually starts in teens and children. And the immune system kills the cells in the pancreas that make insulin, called the islets of Langerhans. If you have type 1 diabetes, you'll always have it, but you can manage it. Of course, watch your blood sugar. You have to give yourself insulin in cases like this. This is where medicine is absolutely necessary. But if you eat a high-fiber diet, fruits, vegetables, nuts, and seeds, hey, that sounds familiar, the fruits, vegetables, nuts, and seeds are going to slowly push the food through the colon and give you a slow release of sugar. And so as you get the slow release of sugar, that takes the stress off the pancreas because the pancreas isn't making it anyway, and your body's better able to utilize the sugar. You need sugar. It's the fuel for your cells. You need glucose. So listen to the show we did on diabetes. If you go to our website, drjoe.com, drjoe.com, we have somewhere between 1,500 and 2,000 podcasts. We have audio podcasts. We have video podcasts. We have articles that we've written. We have blogs. So if you really want, if you're enjoying what you're hearing today and you want to learn more, just go to our website, drjoe.com, and just type in what you're looking for. And you can find articles on brain function and health and women's health and digestion and orthopedics and sports and so many different topics. I like I said, we have about 1,500 different topics. And you can listen to them. You can watch them. A lot of them are videos. You can watch them. So the website is a great source of information. And if you are a podcast junkie, not only do we have them on our website, you can go to your podcast service, whatever you use, and type in these words, Dr. Joe for the health of it. Dr. Joe for the health of it will bring you to our podcast. It's on all the major podcast services. And then you could listen to these little, 24-minute segments that we do on podcasts as well. And you can learn a lot of good information. And if you have any health questions, you can send them to me through the website, drjoe.com. There's a little bot that pops up and says, hi, would you like to chat? Yes, type in your question and give us your email address. And we'll try to get back to you in real time if we can, but it's only me and Joe doing it. So if we can't get back to you in real time, we'll get back to you with your email address. Just check your emails. But we want to be your doctors. We want to be the people you turn to when you have healthcare questions. And we have chiropractors, we have medical doctor, we have a nurse. So we have a group of doctors that are all focused on one thing. And that one thing is get you well and keep you well. Are you a chiropractic case? Are you a medical case? Are you a PRP case? Do you need injections? Do you need medication? Do you need hormone balancing? Do you need supplements? We're able to analyze each patient individually and determine what's going to be the best course of treatment for them. PRP can even be used. PRP is platelet-rich plasma. We take your platelets out of your blood and re-inject them back into the body. It can even be used for erectile dysfunction. Less expensive, and it's your own cells than a lot of the medications that are out there. Some people have adverse reactions to medications. Why not use your own cells? Why not use the safest approach we can? Same thing with women. If they have sexual dysfunction, they may be bladder leakage, you can do PRP for that as well. So why would you try something more dangerous when you can try something less dangerous? And we could always escalate. We could always go to something, more aggressive. Let's say maybe not dangerous, more aggressive. We can always do that. But let's start out basic and build up from there. That's the approach I take for my own health, my staff, my patients. I'd like for you to consider that as an approach, a different approach to healthcare. We don't need to go to the end game right away. Let's date a little bit first. Let's try, go slow. And let's go slow and let's see what we can find out. Maybe chiropractic care solves the problem. You might have a pinched nerve in your low back that goes to your sex organs. Let's fix it. The immune system, which we're talking about today, is affected by the nervous system. So maybe with chiropractic care and nutrition, maybe we can calm down your immune system. Maybe not. But let's try it. If you do want to make an appointment, you can go to our website, drjoe.com. We have offices in Marietta, Duluth, Stockbridge, and West Cobb, the Atlanta area, because I know this show goes all over the world. Make an appointment. Just come see us. We accept most insurances, car accidents, sports injuries. We do the filing for you. If you've ever been in a car accident, ever, in my experience, if the car was damaged, you were damaged 100% of the time. Acid reflux, heartburn, nutritional issues. My team of doctors and I are really good at getting the body well. So we don't necessarily treat the disease. We treat the body so the body can get healthy. So if you want to make an appointment, drjoe.com. We'd love to be your doctors. Other autoimmune diseases, multiple sclerosis. No one, in my experience, has ever told an MS patient to stay away from artificial sweeteners and dairy products. Artificial sweeteners, specifically aspartame, can mimic MS symptoms, symptom for symptom. So if you're diagnosed with MS, you go get your brain scan or your MRI, your CAT scan, whatever it is, and it says you have white focal points on your brain. That's how we diagnose MS. If you don't have that, maybe you're drinking a lot of artificial sweetener. Cut out the artificial sweetener for a few months and let's see if the MS symptoms go away. In many cases, they do. If you have MS, cut out the artificial sweetener. If you don't have MS, cut out the artificial sweetener. Of all the 7 deadly sins, artificial sweetener is the worst, in my opinion. So I would say cut out all the artificial sweeteners no matter what, especially if you have MS. because if you have it, it's going to probably make it worse. If you don't have it, you have the symptoms, you may be misdiagnosed. Cut it out and see what happens. It's pretty amazing. And also no dairy. I also get all the my MS patients off all their dairy products as well, and then hopefully we get to see some good changes there. Irritable bowel syndrome or inflammatory bowel disease, celiac disease. This is the body attacking the colon. And the simplest, easiest thing to do, once again, say it with me, folks, cut out wheat and dairy. Cut out your wheat, cut out your dairy. Watch how well the bowels do. In most cases, even any type of bowel problems. Cut out your wheat and your dairy, give it 2 weeks, go back to wheat and dairy. If I'm wrong, I'm wrong. If I'm right, which I am, you'll be amazed. Also, if you have digestive issues, I usually recommend at minimum supplements I think everybody should be taking anyway. Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 powders. They take a scoop of each. I shook it up with some coconut milk this morning and drank it. You can do frozen bananas, frozen berries with it. I think it tastes great. I love the Super Greens mint flavor. There's plain as well. I like the mint better. It's your call what you like, but I like the mint better. And then I'd also recommend digestive enzymes. Whenever I eat a cooked meal, I take digestive enzymes. Last night I went out for Ethiopian food, my favorite cuisine, and we ate way too much, first of all, and it was just too much volume. And so I took digestive enzymes. It was all cooked also. So whenever I eat an all-cooked meal, I always take digestive enzymes. So I recommend you carry Dr. Joe's digestive enzymes with you. And when you eat a cooked meal, just pop one. I think you'll be thrilled with the results with that. Also, probiotics are really important to keep the bacteria in your colon right, and also turmeric. So if you have digestive issues, the protocol I recommend would be Super Greens and Essential Source, digestive enzymes, turmeric, and probiotics. That's the protocol that I recommend for my digestive patients. But many times when there's digestive problems, it could be a pinched nerve in the low back, which controls the bowels, and or the stomach can be pushed up against the diaphragm. So you might be diagnosed with irritable bowel syndrome, irritable bowel disease, celiac, Crohn's, colitis. And if we can take the stomach and physically pull it down away from the diaphragm, get you off the wheat and the dairy, get you on some good supplements, in many cases, that solves the problem. And I've had countless patients in the years I've been seeing patients, the decades I've been seeing patients, come to me and say, Dr. Joe, I'm amazed. I have suffered 10 years, 20 years, my entire life, and all I did was follow your simple protocol, even though it's an autoimmune disease. And I'm so much better than I ever have been. And then I get the question I get every single day. Why didn't I do this sooner? And the answer is, I don't know. I have no idea why you're not doing it sooner. So if you do want to make an appointment, if you're suffering, I can't guarantee I can help you. But let's see if this is something we can help. I think we can help. You can book an appointment right online, drjoe.com. Lupus is another autoimmune disease. Symptoms include joint pain, sensitivity to light, kidney problems, fatigue all the time. Listen, and by the way, if you have any immune issues, go to our website, drjoe.com, and listen to the show we did on immunity. Just type in immunity or autoimmunity and listen to the whole show we did on that. I think you get a lot of good insight as to other things that you can do to keep that immune system strong. And the website's an amazing source of information. And if you haven't spent some time there, just go there, go down a rabbit hole, read the blogs, read the articles, listen to the shows, audios, videos are there. It's pretty incredible. And if you are a social media person, I want you to follow us on Facebook, Instagram, YouTube, and Twitter. And my handle is @DrJoeEsposito. All one word, @DrJoeEsposito. We post every single day on social media. And sometimes it's nutrition tips, sometimes it's health tips, sometimes it's recipes, sometimes Joe and Jake, who run our social media department, they'll throw a special out there for some of the supplements. So if you're not following us, it's free, folks. And I give you all this information. It's my gift to you. Every week, several times a week, I'm on radio, I'm on television, I'm giving you all this information. I want one thing in return. I want you to follow us on social media. And that's free. So you can't beat that price, right? So that's your cover charge. Follow us on Facebook, Instagram, YouTube, and Twitter. And if you have a social media account, a podcast account, go to your podcast service and type in Dr. Joe for the health of it. Dr. Joe for the health of it. And we have a ton of podcasts there as well. Can't make it easier for you, folks. All right, we're talking about autoimmune diseases, Graves' disease and thyroid disease. Let's cover that because it's really, really, I'd say popular, but it's everywhere. The thyroid gland makes hormones that help your body work in so many different ways. With this autoimmune disease, it takes either makes too much of them or too little. With Graves' disease, it's too much thyroid hormone. And you might have rapid heart rate, bulging eyes, I know a little girl, when she was little, she was just so cute. And she had these big, beautiful eyes, and she was always so hyper and cuddly and jumpy. And she was diagnosed with Graves' disease. She had too much thyroid hormones. She was hyperactive. And in that case, we tried the holistic approach. We tried chiropractic. We tried nutrition. We tried balancing her out the best we could. It was too far gone. She had to have surgery. But all the doctors, it was at Emory, all the doctors, first of all, big fans of the show, which was great. It was kind of cool being in a room with all these doctors going, "You're Dr. Joe. This is really cool." And they said, "You know what, Dr. Joe, I really appreciate we've tried everything, but now I think it's time for surgery." And it was. So we can't fix everybody, but in most cases, we get some great results. So it was really cool to co-manage that case with the doctors at Emory, who, by the way, were amazing. And we tried everything. I taught them a ton of stuff on natural things they can do that they're going to use on their patients, hopefully have. And they taught me a bunch of stuff too. So it's nice that all the doctors are now working together as a team for the betterment of the patient. There was a time when orthopedists wouldn't talk to neurologists, wouldn't talk to neurosurgeons, wouldn't talk to chiropractors, wouldn't talk to nurse practitioners. And now there's not enough nurse practitioners in the world. Oh, by the way, we're looking for a nurse practitioner or a physician's assistant. In case you know anybody looking for a job, have them send their resume to me. I'd love to talk to them if they're into what we're doing here, natural health. Hashimoto's is another thyroid disease, and that can cause some real serious problems as well. And many times your throat is swollen and your face gets puffy. You look like a I want to say moon face because that's Addison's disease, but you get this puffy look on the face. Listen to the show we did on thyroid. If you have any thyroid questions, drjoe.com, just type in the word thyroid. The key to thyroid autoimmune diseases is going to be what? Wheat and dairy. Cut out the wheat and cut out the dairy for those thyroid patients, and let's see what happens. We can also get them on thyroid supplements. I do recommend Super Greens an essential source because it has something in it called iodine. It has sea vegetables. Very few people get enough iodine in their diet. And the iodine is necessary in order to make thyroid hormones. The thyroid hormones, T1, T2, T3, and T4, the numbers 1, 2, 3, and 4 are how many molecules of iodine are attached to that hormone. How cool is that? If you don't get enough iodine in your diet, the body can't produce the right amount of thyroid hormones. In many cases with thyroid issues, you get them on an iodine supplement and the thyroid issue calms down. Not all, but some. And so you can co-manage that with your endocrinologist who's working with your thyroid. But Super Greens, an essential source, are great for, I consider, everybody, but especially people with thyroid conditions because you need that iodine. It's so important. Another one, I'm almost out of time here. Another one is psoriasis and skin rashes. And I sound like a broken record. Cut out the wheat and cut out the dairy. I've had people call into my shows when we do live shows, and I say, cut out the wheat and the dairy, see what happens. 2 weeks later, they call me back. Oh, my gosh, Dr. Joe, it's amazing. Patients, I see it all day, every day. I had a guy call in my show one day, and he says, Dr. Joe, about 10 years ago, I called in with my son who had real bad skin rashes. You told us no wheat, no dairy. We did it for 10 years. His skin has been clear. Every time he cheats, his skin flares up again. So, folks, I'm almost out of time. If you have any questions, send them to me through the website, drjoe.com. If you want to make an appointment to come see us, and I think you should, drjoe.com. You can book it right online. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. We're raising our fees, by the way. Throughout COVID, we discounted the first visit dramatically. So we'll give it one more shot. It's an exam, x-rays, consultation, first adjustment, going over the x-rays on your next visit, and a complete nutrition evaluation. Normally, that's $523. We've reduced it to $249. So if you want to do it, you got to do it quick because we're going to raise that price up real soon. You know, COVID's kind of wrapped up here, so we got to get moving on that. So if you have any questions, drjoe.com is a great source. Follow us on social media at Dr. Joe Esposito. Do that for me. That's what I need you to do that as a favor. At Dr. Joe Esposito, Facebook, Instagram, YouTube, and Twitter. And we post almost every single day. But just become a patient. Come see us. Let's get the nervous system, digestive system, and diet straightened out. Then you can get healthy too. I'm Dr. Joe Esposito, drjoe.com.